Hi, I'm Dr. Matthew Norton, founder of People Plus Purpose, and your host on this episode of the Truth Behind Dentistry podcast. And today, I am happy to have as my guest Liz Lundry. Liz has been a practicing dental hygienist since 1979, an in-office trainer since 1988, and earned her laser certification in 2000. As a consultant with the JP Institute, she works with dental practices all over North America, providing hands-on technology, training with lasers, air polishers, and ultrasonics, integration of nutrition, customized in-office coaching, and rigorous postgraduate seminars and workshops. Liz is a published author, and as a speaker, she has presented at international seminars, national study clubs, and state meetings. Liz is the Clinical Education Manager for Stella Life and the host of the Stella Life Innovators Series podcast. Welcome to the program, Liz.
Thank you so much. It's such a pleasure to be here. So I appreciate you. Thank you.
Yeah, well, I've been looking forward to the conversation, and that's a lot of that's there's a lot of journey probably that could be discussed during the entire program. But I know we have some other things to say. But I always find it fascinating how many you start someplace and you get inspired and engaged, and life just kind of, as we're learning, leads us into new frontiers. So you have quite a resume there that we covered in 30 seconds or whatever that was. So
Yeah, thank you. I'm
um,
blessed with a lot of opportunities and meeting a lot of wonderful people in my journey.
yeah, that's great. That's probably one of the greatest things about it, right? It's just all the wonderful people. So since this is the Truth Behind Dentistry podcast, and we like to be able to uncover some truths that people may not understand, and sometimes explore some leading edge ideas or ideas that still seem leading edge, even if we think more people should be knowing them by any given point in time. But maybe talk to us a little bit about kind of dentistry's move further into total body health, more of that focus.
Yeah, so I have been a trainer with the JP Institute, as you said, since the 80s. And that was really where when I learned more about that connection myself and then was trained to apply that as a hygienist. So my mentor was Jan Lazarus, who was the founder of the JP Institute. And she, as a hygienist, noticed, back in the early 80s, as she was seeing her patients in the Chicago area, that patients healed differently dependent on their health. And she really looked at that and harnessed the immune response and the patient's own natural abilities to heal as she developed this protocol that allows us to treat people really to completion for perio and then to keep them in remission. This is a chronic disease. And as we look at the population, everybody's got some bleeding gums. So that means everybody's got an active infection.
Right.
So as we look at this connection, anytime if we have a bleeding spontaneously any other part of our body, we would be very concerned. We see it so much in dentistry, we kind of accept that.
Hmm.
So this protocol allowed the hygienists, including myself, because I went through this training and I was able to really take a deeper look at everything and kind of connect the dots, looking at the patient's health history, talking to the patient about what was happening in their lives, really taking that time to have that conversation. And then based on all of that information, coming up with a treatment plan that really takes their immune system into consideration. Because to date, the way that we were trained, it's more of a cookie cutter approach
Hmm.
of how we treat periodontal disease. And it needs to be very individualized because everybody is different. So this is the beauty of what Jan developed and a concept called repetitive therapy, whereas we treat people for infection, we start not necessarily like upper right quadrant, lower right, going, bouncing, going through these four appointments
Right.
very much predictably, but really treating the areas that have the most need, the most infection, and then retreating those areas as they came back for their successive appointments. But we harness all the technologies that we have available. So through the years that I've been training, in the early days, we didn't have the ultrasonics. We sure didn't have a lot of the other systems that we now have and the technologies to be more effective with this treatment. And one huge one is salivary diagnostics, being able to figure out what's causing the infection. So when I got trained to do this with Jan years ago, it inspired me so much because it changed my feeling about what I did. The relationships with the patients changed. And I got so inspired. I really wanted to share this protocol with others. And so many have adopted this. And many people that teach programs also have adopted this protocol because it's very effective. And I think we're seeing a trend overall, whereas we have a greater understanding of the oral systemic link, the role that the pathogens in our mouths play, how they trigger this systemic inflammatory response and are clearly linked with dementia, Alzheimer's, many forms of cancer, cardiovascular disease. And there have been so many studies that have shown this connection. And yet, I still talk to clinicians that have doubts about it. So I think that we really need to, first of all, looking at just some common sense. If we see spontaneous bleeding, and there's got to be something going on there, and we need to look at the total picture. Because if we just use the regular modalities that we've been using based on our training, maybe from way back, when, depending
Right.
on when we went to dental school or hygiene school or whatever, we need to use these technology changes to adapt what we do and then be able to be more comprehensive in our treatment. And there are many more and more offices that actually are discussing nutrition and lifestyle changes and maybe have relationship with nutritionists. And when we look at airway and breathing, and the function that people have, this is also something that can be and should be incorporated into what we do as practicing clinicians in dentistry, because we're right there. We're in the perfect position to be able to diagnose these issues and then offer some treatment. So we're just in a great position to, again, put all this together to provide services that are going to enhance our patients' overall health, but most importantly, building that awareness, I think, in our patients.
Right.
So, kind of a long answer to the question, but I do think we're seeing that trend, thankfully, because we need it. I mean, honestly, what we are looking at and being involved also with the American Academy for Oral and Systemic Health, of which Jan was on the board, the CEO of Stella Life, Gennady Sirota, is on the board currently. And this is a group of people that are like-minded, and there are chiropractors, nutritionists, physicians, dentists, hygienists, just all of these healthcare providers that are really acknowledging that link. And it's really a good source to be able to learn more and how to apply these different techniques and these concepts to what we do.
Mhm. To me, it's very exciting. I think we healthcare experts tend to historically be pretty siloed, and they have their territory, their anatomical regions, their physiology that they're focusing on, or pathology, but not seeing the connections. And I coach a lot of dentists for in the relationship part of their work, improving leadership, improving their team culture. But when you were saying those things, I was thinking about how many of them feel somewhat uninspired some years in, somewhat bored with the routine. And I'm thinking how much more compelling of an offering this is for patients, for the needs that they have to have somebody identifying these larger connections, but how much a more exciting playground this really can be for doctors and other care providers to connect these dots and to feel like, hey, this is not just a cleaning, short-term cleaning. This is not just recognizing some other broken something in the mouth, but this is a chance to contribute to somebody's greater well-being. I mean, to me, how much better does that get? So I don't know. I know that we were talking before, like the world was flat for a long time. So I understand there's resistance to change, but it is increasingly hard for me to think that people are not seeing this and wanting to be a part of it. wanting like salivary tests. Like, why would you not, if that's available, why would you not want to explore that a bit more?
I feel exactly the same way, but we know all of us as human beings, it's difficult to change. We grow comfortable in the dogma that we are taught early on, and we tend to get stuck in it unless we have that kind of a seeking mind. But I think your a statement about getting bored is, a huge motivator because we do the same thing over and over again, and there's a certain amount of pleasure and comfort in being really good at doing that. But then after a while, what fascinates me as I see patients, for all the years I was seeing patients, and I would see, they had issues like tissue that is red and dry, where they breathe because they're mouth breathers, or they have different problems because of their bite or the position of the teeth. Or so I like to look at how did they get here? Why do they have these problems and try to connect those dots? And now we're not looking just at the mouth because the patient's body doesn't stop here. Like you're saying,
Right.
we need to look at the big
Right.
picture.
Yeah.
So for me, because I've always liked a natural approach, and that's what the JP Institute does as we go out training offices, also helping with leadership and getting everyone on the same page, but looking at the technical skills necessary to go to that next level, with the patient care. So it was really a wonderful part of my journey to be introduced to Stella Life and meeting the group there because, again, we're all like-minded, using a natural approach to promote health. And so, in all allowing the products to help the patients heal so much better, feel so much better, and help with chronic conditions that there really hasn't been a solution for. So, as part of the development of products with Stella Life, looking and recognizing this oral systemic link, we have these probiotics that have been recently launched and very exciting. There's been a trend to providing oral probiotics to really encourage the growth of the healthy, good commensal bacteria to outpopulate the pathogens. And we're seeing that trend in dentistry, which is really, I think, a welcome trend and exciting to see. So we can use this natural approach to have this nice oral microbiome. But then when we look at the rest of the body, if our in our practices, we are doing surgeries and we're prescribing antibiotics.
Right.
Well, that's going to wipe out the gut microbiome as
Right.
well. So we need to do something to provide an option for patients. And so with Stella Life, we do have the gut probiotic and the oral probiotic available in one package, which is so convenient for the patients because we know that if their gut isn't functioning, we're talking about digestive issues. And I always say Hippocrates, the father of modern
Right.
medicine,
Right.
said that all disease begins in the gut.
Yeah.
And the research is really proving that to be true. So, so many patients that I've seen, and even family members and other people I know who've got chronic eczema or other types of, acne issues or whatever. And as they start seeing functional medicine doctors, they find it comes back to that microbiome of
Hmm.
the gut. So
Hmm.
we need to do everything we can to balance that. And in the tradition of dentistry, we've used antiseptics in the mouth to try to, kill these bacteria. But unfortunately, they've been uh, chemical based and they do provide like an overkill. So they're not only killing the pathogens, but they're destroying the commensal bacteria as well. So, as we look at that, we really need to change what we're doing.
Yeah, well, that's good. Let's come back to that or amplify that more in a minute. But tell me, let's talk just another minute about the oral gut microbe connection. And do you see it? I mean, is that kind of still the conclusion that it is the gut microbial imbalance that is first and then affecting the oral microbiome, or could it go the other way to where there was enough going on here and now, or is it just mutually uh, exacerbating wherever it started?
Yeah, that's a great question. And this is an emerging field of research.
Hmm.
So we're
Hmm.
still learning so much about this. Everything's connected.
Right.
Everything's connected in the body. So if we don't have the proper population of bacteria in the gut, we're going to have immune system issues. that's going to affect our healing from our surgeries or whatever else we're doing in the mouth. So there are issues there, digestive issues, absorption. If you're not able to absorb the nutrients, and you've got a lot of background in this with your own history,
Hmm.
importance of being able to not just eat the right foods, but to be able to absorb them. This is
Right.
another issue that many people that end up seeing a functional medicine doctor, they're not getting better with their regular physicians because they're not testing all of these things. So when we look at the details of the population of the gut microbiome, a lot is revealed because they may have C. diff, they may have other really nasty pathogens there, and that is going to inhibit and not allow that whole organ system to work because now it's referred to as an organ system. We're
Hmm.
talking about 5 pounds of bacteria in our gut
Right.
that helps to control our hormones, helps to control our blood pressure. Same with some of the commensal or friendly bacteria in the mouth also have that ability and are part of that whole organization to control blood pressure, to control the hormones. So when
Mm.
those are wiped out, we see huge problems with that. And studies have shown that when somebody uses some of these alcohol and other chemical-based rinses, and for example, chlorhexidine, if you use that twice in one day, people's blood pressures can go up by up to 3.5 points,
Wow.
which can be significant
Yeah.
for a lot of people.
Yeah.
So, if we're going to be doing anything like Hippocrates said, first do no harm, right?
Right. Right.
Want to do that, we want to set a stage where we're going to have a wonderful ability for the patients to heal. And this is one thing we can provide for them.
Yeah, that's great. That's great. So as far as the chlorhexidine, then what's your take on why we're still caught in the use of that, no matter what the research is revealing, and what to do instead?
Yeah, it's again, it's one of these things that we've been used to doing things a certain way, and it's been the gold standard for decades. And there have been changes as I go to a lot of courses and I speak with a lot of dentists and some students that are still in dental school and residence and perio programs. And I talk to them about, are you still being taught to use chlorhexidine? And we're seeing a shift. So they're talking about the toxicity of chlorhexidine, and some of these students are using just saline
Hmm.
uh, as a disinfectant. But we can use products like Stella Life, which I'll talk about in a bit, which does more than disinfect. It accelerates healing and really does so much more. So the patient has a better experience, and we have better experiences, predictable healing after surgeries are
Right.
done, other procedures. So actually, with the chlorhexidine, if I can share my screen, I'm going to show you just a few studies that we've had, some university studies. So let me get this here for you. And you can see this study from Bern University. Can you see it on the screen
Yes.
there?
Uh-huh.
So this was the first study that the university has done with Stella Life rinse. And here the rinse was compared to chlorhexidine, finding that the chlorhexidine is very toxic and that there was no toxicity with the Stella Life. And this also was the first study that demonstrated that using the Stella Life rinse actually accelerates the growth of human fibroblasts.
Hmm.
We know that chlorhexidine actually kills fibroblasts
Hmm.
as well as osteoblasts, and we don't need, that's the last thing we want to do if we're performing any surgeries like
Right.
bone grafting or implants. And, we're going to see more and more implants being placed moving forward. So this was one study. This study was also really interesting here done at the University of Texas. They compared the Stella Life rinse to chlorhexidine, to saline, and to Listerine, and found when you look at these different samples here, when the Stella Life was assayed, here is the fibroblast activity that was
Hmm.
found, the Stella Life sample. And when you look at the chlorhexidine sample, we see that nothing is growing
Hmm.
there because not only has it killed the osteoblasts and fibroblasts, but we know it's also killed the good, the bad, and the ugly. I mean, it's
Right.
killed good bacteria as
Right.
well
Yeah.
So we've got that issue going on. And here's the control with normal fibroblast activity. So with the Stella Life sample, we see that we can really hugely increase that fibroblast activity so we have more rapid collagen formations. And in our practices where doctors use this with surgeries, we generally see a month's worth of healing within a week. So it's wonderful for that. This is another study where the gel that we have was compared with chlorhexidine, povidone iodine, and Sciences AO gel. All of those other products have toxicity. Again, none with the Stella Life gel, but this gel also, accelerates the growth of fibroblasts. So again, we here have a product that is not toxic in any way. And we know that the alternatives that we've been using pretty much all of them have some toxicity.
Yeah.
And there were issues during the pandemic when people weren't able to see their dentist during the lockdown, and they were using Listerine and other heavy
Right.
duty rinses.
Yeah.
And then there was evidence that showed a huge number of these people got their blood pressure went up and they had heart attacks, and many of them didn't survive. So,
Wow.
and they know that they were not COVID-19 tests. There are studies that have shown that too. So we look at people using these heavy duty rinses and they're really doing more harm than good. And we're seeing a global trend where one country after another is banning the use of chlorhexidine for intraoral use because of the toxicity. So, and we're seeing that there is a trend amongst doctors here looking at that. And no one likes using chlorhexidine. I do meet occasional people say, "Oh, I love it. I love it. It kills
Right.
everything." Yes, it
Right.
kills everything, but you don't want to kill everything.
Right.
But we're seeing when I talk to most clinicians, they're complaining about, how nasty it tastes, the burning sensation, the staining it leaves, and there people can get this metallic taste in their mouth while they're using it. So it's just not a pleasant product to use, and it's problematic besides
Yeah.
that.
Yeah. Yeah, I think we are getting more and more savvy about toxic exposures in general. Um, But I think also I've heard it said before that we talk in terms of side effects. We just should say effects, right? Because sometimes side effects makes it sound like some minimal, marginal kind of something that might happen. It's like, no, these things are happening. We are killing off good things in it, so um, sometimes we think we're controlling for one effect and we're getting all kinds of other unintended or unseen effects as well. So I think the approach is really important. So sometimes we're needing to focus on pain relief.
Yes.
Sometimes that also connects with the need for greater wound healing, right? So maybe talk to us about those, I guess, different but complementary things to focus on.
Yes, yes. And when I started being a hygienist, this was like a long time ago. We didn't wear gloves or masks. I was in the first class in California where hygienists administering local anesthetic was part of our curriculum.
Wow.
So your students would come back. So I've done it all my life, since
Yes, right.
1979 I've been doing it, but there are still states where that's not happening. And I really believe that in the 21st century, there should be no reason for our patients to experience pain in the dental office, and we should do everything possible to eliminate pain after they have any type of procedures that are done. And so, we've been relying on pain medication for that. And we've been using in dentistry the acetaminophen and the Motrin combination, very commonly. But opioids
Right.
have also been part of the protocol and still are.
Mm.
And the standard of care still is with any surgery to dispense 20 or 30 Vicodin or whatever it is
Right.
that they're
Yeah.
dispensing, where reasonably speaking, maybe two or three would be all you
Right.
need.
Right. Yeah.
Because from what I understand is it doesn't really do anything to minimize the pain. It just changes your perspective of what's happening. So you
Yes.
just don't care. So you really need the
That was
anti-inflammatory.
my experience, right? When I've had the
Yes,
device.
yes. Yeah. And what's it really interesting or really tragic. I mean, we know from the opioid epidemic, we are all the doctors now have to take a course, the opioid course, as part of their continuing education,
Mm.
to be aware of the dangers of these opioids. And apparently, I was able to attend one of these courses recently. 1 in 10 people become addicted from one exposure.
Wow.
So that's
Yeah.
pretty frightening. And
Right.
then I found out I live in a nice neighborhood just outside of San Francisco, a pretty affluent community with great schools, some of the top schools in California. And I found out from my kids that kids are selling their leftover opioids
Mm.
that they get for their third molar extractions or
Wow.
for athletes that, hurt themselves and have to
Right.
have orthopedic surgery. And depending on the dosage, the price per pill changes.
Wow.
So there's this whole cottage industry going. So we, wonder, oh, these kids, we can give them these things, they'll be fine. But they're dispensing it
Right.
themselves.
Yeah.
So that's dangerous and the addiction level. So with Stella Life, because of the active ingredients in the rinse and the gel, it does provide analgesia. So when the products are used ideally preemptively before they come in for the surgery, we have these elements building up in the bloodstream and they reduce inflammation, reduce bleeding, even help to reduce anxiety, but
Mm.
also provide some analgesia.
Okay.
So, and the gel itself, when it's applied to any lesion, which is part of the Stella Life protocol, whether it's a surgical wound site or a herpes simplex lesion or any other concern that a patient may have, like a canker sore, it provides pain relief within 2 to 3 minutes that lasts up to
Mm.
3 hours. I've had two perio surgeries where
Mm.
my pellet was a donor site twice,
Hmm.
and I didn't need any opioids, and I don't remember really being uncomfortable. Of course, I used my Stella Life recovery kit, and
Right.
if there's any discomfort, I would, use it, put the gel on there, use the rinse, the sublingual spray, and I was good. And I always have my surgeries in December because there's a bit of a, recovery time.
Right.
So
Right.
even last year, I had it done at the beginning of December, massive bone grafting, root coverage. It was a big procedure.
Mm.
And we have my family is Polish. We have a cultural Polish Christmas Eve
Ah,
celebration that
okay.
involves yummy foods and a
Yeah.
bit of vodka. And I was able to enjoy everything within 2 weeks of having my
Wow.
surgery because I healed
Good
so
for
fast.
you. Yeah. Good for
A
you.
week worth of healing in a month's worth of healing in a week
Wow.
is what we see with Stella Life. But patients are so comfortable and they rave about this, and the doctors get less calls on the weekend that someone's in pain. And that's so important because it's scary enough for people to go through surgeries and they're nervous anyway. And then for them to have to deal with a lot of pain afterwards, we want to do everything to reduce that. And we hear stories from doctors about how when they used chlorhexidine and before they started using Stella Life, they would have sutures opening up and
Mm.
losing membranes and things like that. And they just don't see that when they use the Stella Life.
Yeah, that's great. I mean, so multiple contributions on the pain element. What just a little bit more. Are most people finding this approach to be sufficient from a pain perspective? Is that, or are you finding it's diminishing the pain to where other, maybe acetaminophen or Motrin would complement that, that maybe it's not a full enough pain relief, but enough to not have to go in the opioid direction?
Correct. There is actually, we do have a pain management protocol, and that does include acetaminophen and Motrin,
Okay.
which is taken for a couple of days, to really maximize the reduction of the inflammation
Mhm.
and to help with the pain management. But when that's used together with the Stella Life, they're good. And it's
Yeah.
haven't heard of many instances where people were still having any pain.
Yeah, that's good.
So that's the response, and that's what we see, which is why the products become so popular. And once these doctors who are doing these procedures start using it, and see these results, they
Right.
definitely want to keep
Right.
using it
Yeah.
because it makes everybody's life better and easier and providing that comfort for the patient. But
Yeah.
yeah, you do need to have the anti-inflammatories as part of that protocol. And when we work with offices, we provide training for them. And we have an oral surgeon on our team that helps to support them as well. And we teach them that pain management protocol together with Estella Life.
That's great. That's great. I mean, I don't believe anybody would not want to be doing the best for their patients. It just seems like not enough people know that this is another option who would want to be giving opioids if they trusted that there was another avenue that would work well. But I
Yes.
think not enough people have known. And then it's also, am I willing to trust and to walk into making a change? But they're not going to make a change if they don't know. So I'm glad that you're doing what you're doing and sharing your inspiration and getting that message out that there are other really viable options for pain, but also that can accomplish these additional healing effects, so that it's not just a focus on just temporary relief kind of thing. I think that that's good. Well, as we wrap up, I feel like we could keep talking for another hour or two probably, but uh, given your clear focus from things we talked about before we even started this conversation, and what you've shared, your focus on helping people's lives be better, right? I mean, so how a little bit more about how you're doing that, and then also maybe you could go into, then if people want to know more, what's the best way to connect with you or to find out more about what you have to offer, what Stella Life has to offer, what maybe JP Institute has to offer, anything like that.
No, thank you. Thank you for that. So, getting back to the mission of Stella Life and my own mission, and I think yours as well, is
Mm-hmm.
to improve people's lives. You
Mm-hmm.
know, that is why we're here. So, we have the patients who are going to go through the surgeries. We definitely want to help them, of course. But we have people that have chronic conditions such as lichen planus, oral pemphigoid. People get candidiasis, different types of inflammatory mucositis. Patients that are going through chemotherapy or radiation of the head
Mm,
or get terrible mucositis and
mm,
mouth sores. All of these conditions, we can provide relief for our patients with Stella Life. So they can use that recovery kit to get their healing started. And then, because some of these conditions are chronic, they can use these rinses and gels ongoing, and they just don't get that mucositis. Our oncology patients are reporting that they're not getting the mouth sores. They can continue to eat while they're fighting their cancer.
mm.
And when I first started with Stella Life, we were a small company. I was taking 800 calls 5 days a week, three and a half
Wow.
hours a day.
Wow.
Just so many people who told me, a lot of these were elderly people who are not comfortable using the internet, who will call to place their orders, and they're saying, "Hey, I have dry mouth. I'm almost out of my Stella Life." And then we get into these conversations, and they would share how their lives have changed. So it just feels so good to
Right.
provide something for things that we've never had an option for. We've
Right.
used steroids for these conditions. Steroids have their own side effects. So we can improve their lives this way. So many conditions, not just the surgical patients. We're talking about ortho patients, denture patients. Everybody's got issues, and everyone's got bacteria above
Right.
threshold.
Yes.
So
Yes.
we can get that periodontal disease under control because they can use this daily for life as a daily product, just to have good hygiene and to keep that good bacteria going, because it enhances the growth of the commensals, but keep the pathogenic bacteria in check, which allows them to have a healthier body as well as a healthier mouth.
That's
So
great.
that's the goal.
Yeah.
And with Stella Life, we donate to people who are going through cancer treatment who can't afford it. We will donate to them. We really want to support these people. And we've had members of our team members have family members and friends who have lost their lives to opioid overdose. So we're really committed to improving lives that way. And with the JP Institute, as we go into practices and work with the whole team, and it really depends on, of course, what the doctor wants to accomplish.
Mm-hmm.
But these offices generally are not just about having us help them for profitability, but when you do everything for your patients that they
Right.
need, you're going to have that profitability anyway.
Right. Right.
Having them have that foundation of looking at the whole body, discussing that with the patients. And when we go into an office, we work with them it's a customized program as JP trainers, and we provide ADACE. So all of the techniques and things have all been reviewed, and everything is science-based. So we're able to get that harmony within the whole team,
Mm-hmm.
because everyone needs to support the patient. The patients ask everybody questions, not just the doctor and the
Right.
hygienist, but
Right.
the administrators. So everyone needs to have that passion to really step up what we're doing to go to that next level, to look at the whole body And I think that education of the patient, taking the time for the education, which is challenging,
Right,
but
right, right.
do that, it makes all the difference. It just comes back hugely for them and for us if we can spend that time.
Yeah, that's awesome. So if people want to connect and know more, what's the best thing to do?
So they can definitely contact me. My email, Lundry, Lundry at stellalife.com. Probably the easiest way. If you can always also contact the JP Institute directly, the jpinstitute.com, as well as going to stellalife.com directly. We have people who are there to help. And then again, here to help answer any questions, and I just really want to support the dental community.
Yeah.
So, we are in a position to change the face of healthcare in the
Yes.
US.
Yes.
Nothing less than that. This is a huge mission, and I'm honored to be able to hopefully inspire people.
Yeah.
Taking one step forward in that direction
Right.
is a huge win.
That's great. Yeah, we can all play bigger, right? We can all contribute at a next level up, and we need to keep learning so that we can be aware of what those options are to keep moving forward. So I appreciate you. I appreciate the time. This has been I think, a fascinating conversation, but also an enjoyable one as well. So uh, and I would encourage everybody that's watching to reach out and connect and learn more and see what makes sense as a next step for them. So, and would love to have this conversation continue at some point moving forward. So thank you for your time, Liz.
I had a
This has
great
been great.
time. This is wonderful. I appreciate you for what you're doing. So yeah, yeah, let's both keep it up.
Yeah, yes. Thank
Thank you
you.
so much.
Thank you. And thank you for everybody watching. This is The Truth Behind Dentistry with Matthew Norton and Liz Lundry, and we look forward to seeing you next time. Thank you.